Hello, my amazing mummies, and welcome back to the Real Mummy Podcast. I'm your host, Lucy Dalton, and as always, I'm here to bring you authentic, unfiltered stories and expert advice to help us navigate this beautiful, chaotic journey of motherhood together. Today's episode is one you don't want to miss. We're diving deep into the fascinating and sometimes misunderstood world of breastfeeding. Whether you're a soon-to-be mum, a new mum, or a seasoned veteran, breastfeeding can bring its own set of unique challenges and triumphs. I'm thrilled to welcome Leah, a physiotherapist turned breastfeeding counsellor and a dedicated mum of two. Leah's incredible journey from her professional career to becoming a passionate advocate for breastfeeding mums is nothing short of inspiring. We'll be debunking some common myths, discussing the emotional roller coaster, and sharing practical, real-life tips to make your breastfeeding experience smoother and less stressful. Leah sheds light on topics like achieving a perfect latch, the truth about foremilk and hindmilk, and balancing breastfeeding with a busy working life. So grab a cup of tea or coffee, get cozy, and join us for an empowering conversation that's all about supporting each other and finding the joy in our breastfeeding journeys. Let's get started.
So can you start by telling us a bit about yourself and your background?
So I started off as a physiotherapist, working with a wide variety of different musculoskeletal presentations in private. I then became a mum, and my own personal experiences with motherhood then further sparked my own interest in supporting other mums in their pregnancy and their postpartum journeys.
Oh, that's so great. So what inspired you to work with breastfeeding mothers?
Yeah, becoming a mum, my whole world changed.
Mm-hmm.
And, I experienced all the highs, all the lows. My own breastfeeding experiences were a bit like a roller coaster. At times, I was left feeling a little bit unsupported. And it wasn't until I came across the right health professionals that helped me and guided me and held my hand through it. And I was able to overcome my own difficulties. And breastfeeding ended up being a really wonderful, pleasant experience. And now for me, I want to be able to help other mums through any challenges that they might be having. And if I could just make like one mum's life easier, then to me, it would be worth it. So contributing to make a difference, I guess, in increasing support and breastfeeding rates within Australia. And I think this support is just so needed. And it's something that a lot of mums, they often don't get or they don't know where to find it. So I guess that's why I want to work with breastfeeding mum.
I love that because there's so much misinformation about breastfeeding out there. You don't know where to look and you hear one thing, you hear another thing. So this is why I was so excited to do this episode with you, because I was like, I want to start debunking some of those common myths and all the things you hear and encounter. So have you got a few for me, some really common myths?
Yeah, there's a lot out there. So much misinformation. There's a lot of myths that I do come across more often than others. I guess one that I often do get asked about or is sort of, out there in the world that isn't necessarily true is that larger breasts will make more milk or smaller breasts will make less milk. And that's certainly not the case. So breast size does not determine how much milk the breast can make. If you think of breasts as having two types of tissue, so one type is the fatty tissue and the other type is the glandular tissue. Fatty tissue is what determines breast size, and the fatty tissue doesn't make milk. The larger the breast, the more fatty tissue. The amount of glandular tissue the breast has actually determines how much milk a breast can make. So glandular tissue is developed during pregnancy. So even a woman with smaller breasts, as long as she has sufficient glandular tissue, she will be able to produce just as much milk or even more than a woman who has larger breasts. So it really depends on the type of tissue rather than the actual size of the breast. Um, another myth that I hear about a lot is that babies who are breastfed will not sleep as well.
I got told that.
Formula fed.
I got told that all the time. All the time. And it was funny, it was my friend who's a midwife actually said it. And I remember she told me that like the babies are up more because they're breastfed. She's like, the formula fed babies are the ones who sleep all night. So, and that was my friend who's a midwife telling me that. So that's not true.
There's not necessarily true. So there has been actual studies that have looked at this, and studies have shown that mothers of bottle-fed babies up to 12 weeks old don't actually get any more sleep than those of exclusively breastfed babies. In fact, what we know about breastfeeding is that when a woman breastfeeds, a hormone called cholecystokinin is released. And this actually makes both mum and baby feel really sleepy. And so this will assist mum and bub falling back to sleep very quickly. So, if a breastfeeding mum is waking up to do those night feeds and she has a breastfeed, she will actually get quite sleepy and then she'll be able to fall asleep a lot faster. So it can actually, in a way, assist mothers in getting more sleep. It is a bit of a myth, and I don't think we can exactly blanket babies in bottle-fed versus breastfed babies because every baby is different.
100%.
Every baby has different needs and patterns and, development. And that one there is a common one I hear a lot, but there are studies that, disprove it. So
I think so as well. And like my two were both breastfed those first few months and it was the same thing. But I remember my youngest, I would breastfeed her and she would go straight back to sleep, like no issues. But my first didn't, like not at all. I'd be bouncing her for like an hour to get her back to sleep. So it's true what you said, like every baby's different. So I suppose every breastfeeding journey would be different with every child as well. Is that right? Do you reckon?
Absolutely. I do speak to mums about this a lot as well, and they're quite shocked at the difference. They'll often say, "Oh, my first baby never did this, and now this baby's doing this, and I don't know what to do." And so, even if you've breastfed one baby, two baby, five babies before, the next baby that comes along could be completely different as well. So yeah, every baby's an individual and keeps us on our toes, that's for sure.
Well, that's it. That's just kids throwing us a curveball. You think you've got it down pat and you're like, I've got this mothering thing down, and then, oh no, let's throw another one in there for mum.
Absolutely.
So is it true that some women just can't produce enough milk?
Yeah, so it is. Although most women can make enough milk for their babies, there are some women that are unable to physically produce enough milk. So an example is what we talked about earlier, that glandular tissue. So if a woman isn't, for whatever reason, able to develop enough glandular tissue throughout pregnancy, then she won't be able to produce an adequate amount of breast milk. And that's known as a condition called insufficient glandular tissue. Other causes can be, there's lots of different medical causes, but other ones could be like a retained placenta, a mother who's had severe blood loss after birth, any previous breast surgery, or any other sort of range of surgeries or medical reasons. So even though these cases are uncommon, they do occur. So it can be a bit of a tricky one to manage. More commonly though, for mums, there's a perception that there's a low milk supply when in fact there actually isn't one. So it's really common for mums to worry that they don't have enough milk or their milk supply is low when actually it is more than enough. So with working with these mums, it's important for me to figure out, is it a perceived low milk supply or is there truly a low milk supply? So a few of the ways that we might figure this out is just by looking at the baby's output. So like how many wet and dirty nappies are they having in a 24-hour period? What's their behavior like generally? Do they have periods of being settled throughout the day, or are they always really upset and fussy? Are they meeting their developmental milestones? How's their weight gains looking? So all of these things help us form a bit of a better picture about a baby and how much milk they're getting. On its own, just having a baby who's unsettled or cries a lot is actually not a sign of low milk supply. And also having breasts that suddenly feel empty is also not a sign of low milk supply. So this can come into those common myths that we talk about, and particularly for mums in those early days, soon after they'd had a baby, they have an abundance of milk supply. And then after about sort of maybe 6 to 8 weeks, the breasts start to adjust to baby's demand and supply can drop slightly. And mothers might notice that, the breasts are feeling a little bit softer than usual. They're not as full, not as hard, and then they think they don't have enough milk. But when in actual fact, the breasts have just adjusted to what the baby is needing and what the baby demands, and it's not necessarily a sign that milk supply is actually low. It's just meeting the baby's needs at different stages and ages.
That's so interesting you've said that, because I remember the same thing, like in those first few weeks where your boobs kind of feel like bowling balls. They're so big and they're so engorged, and when your milk comes in, and then after a while, I remember feeling the same thing because they stopped getting that really full feeling. Like, and I was thinking, I was like, have I run out of milk? And it's crazy, you're second guessing yourself. So I didn't know that they do eventually settle down. I just, in my mind, I thought, well, I don't have enough milk because they're not filling up. They're not feeling uncomfortable and engorged like they did at the start.
Absolutely. Yeah. And in actual fact, it could have been a sign that, your breasts were starting to meet your baby's needs and baby's demands. And it's a really, really common one.
So another one I've always wondered about. So does breastfeeding always come naturally? Is that a myth or is that a truth?
So breastfeeding is certainly the way that nature intended for women to feed their babies. However, it is a learned skill and absolutely does not come natural. So it takes a lot of practice, a lot of trial and error, but with the right support, the right information, most women are able to breastfeed successfully. And this is certainly something that I also learned the hard way when I first had my baby. I didn't do much education or preparation. I was a bit naive and I just was like, oh, yeah, I'll just breastfeed. It'll be easy. It's supposed to be natural. I don't have to do anything. And my baby was born and I got a shock. And I thought, wow, I actually have to invest a bit of time and effort into practicing this skill. And I became a bit frustrated when it wasn't working well. And, I started to doubt my body and what I could do. I was like, well, surely I could just breastfeed. That's, it's just what mums do. But it really is a learned skill. And I guess my recommendation is to just try and learn as much as you can about breastfeeding. So if you're listening in and you're pregnant, take those classes, ask any questions, and hopefully that'll make that transition a little bit smoother once your baby's born.
I was the exact same. I remember like, oh, it's the most natural thing in the world. I was so like, it's going to be fine. Like once I've got them down, and like I had no idea about the latching, the positions. Like, to be fair, I didn't really go to that many classes, but I just kind of thought like it's natural. Like my best friend's a midwife, and I'm like, I've got this down. And it's just so, even just the positioning, and it's just so awkward. And yeah, it is. It's hard work. Like it's not in the movies where they just pop them on the boob and then that's it. Like it's not like that in real life.
Yeah, and I think that is a really common misconception. And if you are pregnant and you weren't aware of that, and then you have your baby, it is a big shock.
Yeah.
And it can be something that actually halt as a woman in breastfeeding, because they start to doubt themselves and wonder if it's really for them. And in actual fact, it does take practice and time. And no one is expected to be an expert at breastfeeding the second their first baby's born. It doesn't happen.
I remember like that, just feeling so kind of disappointed in myself and looking at other mums, and I'm like, this is the one thing I'm meant to be able to do. And I was like, how can I not do it? And I just felt like, I was just so awkward. But then as well, I was comparing myself to mums who had 2, 3 babies, and they were so comfortable. And it was second time around, I wasn't as awkward, and she fed so much easier because I kind of knew I'd put in the hard work first time around. So I was prepared, it was just, but yeah, it is a big shock.
Absolutely. Yeah.
So what are some practical tips for new mums that they can take away if they are worried about their milk supply?
Yeah, it's a really good question. I think firstly, it's really important to seek support and seek help, particularly from someone who's up to date with their training in breastfeeding. So whether that's child health nurse, a lactation consultant, midwife, breastfeeding counsellor, or healthcare provider, and they will work with you in determining whether there really is that true low milk supply. And then if there is, that's okay. You can receive the right support that's suitable for you in your baby situation. So I guess in general, if it has been determined that there is a bit of a low milk supply, some general ways of boosting supply can be to firstly feed frequently. So breast milk is made, or well, the theory of how breast milk is made is that the amount of milk that is removed from the breasts will then determine how much milk the breasts make. So feeding more often is like the simplest and most effective way to increase your baby's milk intake and to boost supply. Most babies will need at least 8 to 12 feeds in 24 hours. And some babies will feed more than this. So, particularly young babies, they sometimes can feed every hour. And that's a good thing because it actually helps to boost and maintain a mother's milk supply. A couple of other things that mums can try if they're worried that that they've got low milk supply is that whenever their baby's awake, just offering the breast like little snack feeds, even if their baby seems content. So, not waiting until your baby gets to that stage of crying and being really hungry. You can offer little snack feeds here and there throughout the day as well. Offering the breast to soothe your baby rather than using other comforts like a dummy. Offering both breasts can be really important as well, and then offering it again. So sometimes we suggest to mums, say, feed on one side, then switch to the other, and then it's okay to go back to that initial side again. And doing that frequently can actually then provide more stimulus to the nipple, which will then send those messages to the brain to make more milk. A couple of other things to consider as well would be just checking on a few things. So checking that the baby is positioned and attached well at the breast and that they actually are effectively removing milk. So a baby who's not positioned or attached well might not actually be removing a lot of milk from the breast. So then therefore less milk will be removed, less milk will be made. So that can sort of slowly over time contribute to a reduction in milk supply. And then I guess it can be helpful. Some mums like to try different strategies which will help with getting the milk to flow. So some mums might use relaxation. So taking deep breaths, using visual imagery to imagine the milk flowing, feeding in a nice, comfortable space. Some mums will use warmth. So whether that's from, a warm shower or a warm bath, or even just using like a warm washcloth before a feed, that can also help to encourage the milk to flow. And even just using your hand to gently stroke the breast down towards the nipple. So this is like a really light stroking action, as if you're imagining that you're stroking a cat very gently. It's not, like a deep, firm massage. That's really important. So just a light, gentle stroking can also help to encourage the milk to flow. And then some mums also could consider expressing milk. So
Through
whether
pumping
they
or?
decide to pump.
Yeah.
Yeah, so it could be pumping or hand expressing. So again, it's just around that basis of removing more milk from the breasts will then contribute to the breast making more milk. So if expressing is needed, then that can also be a helpful strategy.
Amazing. So you mentioned before about the latching with the babies if they've kind of haven't got the correct latch. So I didn't realize what a thing it was, how they have to be able to have the whole nipple in your mouth and the way they come at it, and like pretty much, the nipple has to be on the top of their mouth, and there's so much about the position and everything. So I wanted to ask you this one, what should new mums know about achieving a good latch? Because at the end of the day, that's almost the most important thing to kind of get you started.
Yeah, it really is the bread and butter of successful breastfeeding. So it can be really worth learning about. And I won't go through all the steps that we sort of look for because there is a lot. But I guess when talking about attachment at the breast, the big key is for the baby to achieve a really deep mouthful of breast tissue. So one of the most common problems we see is that babies have a really shallow latch and they're actually just latching onto the nipple rather than taking a whole breast into their mouth.
And that would be painful.
And of course, that's going to cause pain, pain, cracked nipples, all sorts of things. And then, of course, a baby won't be able to remove as much milk from the breast. So look, in the early days, both mum and bub are learning to breastfeed, and it really does take a bit of figuring out and lots of practice. So, if you're in those early days and you're experiencing nipple pain, like it is common. Nipple pain in the first 2 weeks after having a baby is really, really common. But often just with a few bit of, corrections with positioning and attachment, those problems resolve fairly quickly. And like we said before, no mum's going to be an expert on this straight away, and that's completely okay. And it does take that practice and time. And I guess it would also be worth mentioning about the different ways of going about achieving attachment at the breast. So there's generally two types that we sort of group into. So there's the mother-led attachment, and then there's baby-led attachment. So mother-led attachment is, what we might typically see when a mother will hold her baby in a particular position, whether that's, cradle hold, cross cradle hold, football hold, and she's virtually guiding the positioning of her baby at the breast, and holding her hands in a certain way to then encourage the baby to come onto the breast. And then baby-led attachment is more where the baby is in control of what position they get on, how they latch. So this works particularly well for babies in the really early days. So when a baby's born, they have this really strong reflex to seek the breast and to attach and suckle at the breast. So if you've ever seen a mother use baby-led attachment, it's quite amazing. And the babies, they get placed on the mother's chest, and mother might have their hands just sort of around, but not sort of pushing or positioning the baby in any way, but just there to provide support if needed. And just watching a baby sort of bob their head, wiggle around, suckle, they can actually wiggle their way up to the breast, find the nipple, and then attach on themselves. And it's quite incredible. And this is something that often we suggest mums try. If they've tried mother-led attachment and things aren't working well, sometimes it can be a really nice reset to just allow the baby to follow their instincts and try that baby-led attachment method to sort of, reset and get back to, getting that really nice, effective attachment to the breast. So, it's quite amazing. There's some really good videos of this. So there's a website called globalhealthmedia.org, which you can check out. Lots of different videos and information on breastfeeding, but there's a really beautiful one on baby-led attachment. The Australian Breastfeeding Association also has some really great explanations and step-by-step guides on how to achieve, a really effective positioning and attachment at the breast. Good one to check out.
That's amazing. The baby will just kind of like almost like wiggle its way up. And I think I've seen a video like that, and it's just amazing. I still find it the most beautiful thing in the world. Just birth and that first moment. It's just like, it's so special. But just, like that's just pure nature, isn't it? It's just amazing.
Mm-hmm. Yeah, it is wonderful. And it is really amazing to witness, mothers and babies just doing what nature intended.
So the world is such an open place now. And like, we live in Australia, we have so many different cultures here, and it's absolutely fantastic. So have you found, do any cultural myths and family traditions impact a mother's approach to breastfeeding? Have you kind of come across anything like that?
Oh, absolutely. There's copious amounts of research and studies which have shown that mothers' decisions on feeding practices are really strongly influenced by culture, religion, family traditions, or even the society which she lives in. So things like culture and family traditions and religion, they can often be so deeply embedded that even though a woman's desire to breastfeed might be high, her cultural beliefs are still more likely to influence her choices. And it's also not uncommon for a woman to follow her cultural beliefs and traditional family practices, even if they might conflict with evidence-based information or recommendations. So without going into specific details and examples about different cultures and different traditions and how they influence breastfeeding, I think that would be an entire podcast on its own. But I think it's just really important that we acknowledge that each mother's beliefs are unique, based on her own history, her own story, and we need to be really respectful and understanding of this. So we as fellow mums and even healthcare providers, we need to acknowledge the complexity of these individual differences and understand that they really do strongly influence a mum's decision on how she chooses to feed her baby. And we need to be accepting of those decisions. So even if they conflict with our own beliefs or our own story, at the end of the day, what is right is the way that each individual mother feels is right for herself and for her baby.
I love that. So I suppose, because obviously we mentioned, obviously you're a breastfeeding counsellor and you work on the breastfeeding hotline. So I love that so if women are ringing up and they've got questions, and like you said, if their beliefs don't always align with kind of the current things that what you recommend, but it's so nice to hear you as a fellow mum and a breastfeeding counsellor be like, at the end of the day, the world's not black and white. Like, everyone's going to do what's best for them. And it's such a beautiful, like, a non-judging, I just love it. That's the way it should be, just building mums up and trying to do their best.
Mm-hmm. Mm-hmm. And it's meeting mums with that unconditional positive regard and, respect for her own choices and her own decisions, and helping her figure out what's right for her and her family, even if that might conflict with, your own beliefs or what society says. So yeah, I think if we keep that in mind, when we talk about anything related to breastfeeding, these cultural influences, these histories, these stories, they're all going to be so unique to each individual mum.
Yeah, I love that. And it kind of follows on to my next question. So, every mum who has had a baby and has attempted to breastfeed or has successfully breastfed has had some kind of comment or advice, from friends and family. And as mums, we know sometimes that's the last thing you want to hear. So, how how do you think mums can navigate that well-meaning but often misinformed advice from family and friends? Because at the end of the day, a lot changes in 20, 30 years from when your own mum has breastfed.
Mm-hmm. Oh, absolutely. Mums are bombarded with advice and opinions, and when it comes to anything to do with motherhood and raising a baby. And
And it
most of
doesn't,
the time, this
yeah.
advice is really well-meaning, but it doesn't mean it's really helpful or it's really accurate. So, at the end of the day, we can't control if, when, or what sort of advice will be offered. But we can always control how we respond to it. So, as we said before, everyone's situation and family is unique. So, there's not one size fits all approach. What most mums will probably find it helpful is to establish what their own beliefs are. So, what are the things that they want and what's really important to them and their baby, and getting comfortable with these things early on. So, even during pregnancy, it can be a really good foundation. So, then when those advice or opinions are offered, you can then ask yourself some questions like, what are the risks of taking on the advice? Are there any other options? How do I feel about this advice? And that one's really important. So, remembering that you know your baby better than anyone else. So, trusting your intuition, trusting your mum gut, because at the end of the day, that is just so powerful.
Mm-hmm.
And then, how do you respond? So, it can be helpful to then thank the person who's giving the advice, even if you don't agree with what they've suggested.
Yeah.
Just by thanking them acknowledges them, but it doesn't insinuate that you'll necessarily follow their advice or that you agree with it, but it acknowledges that you've listened. And then if there's any conflict that arises, I guess just trying to remain assertive. So, sometimes things can get a bit heated, and all you can do is just agree to disagree and move on. And then I think as well, for mums who might be feeling like they're surrounded by people who aren't really supportive of them and what they want, it can be really helpful to then reach out to try and find other like-minded supporters, whether that's other breastfeeding mums or a health professional or, a particular friend or family member. So trying to find those people that will help and support you throughout your choices and what you want to do can also be really beneficial.
Definitely. And I think that's the thing. It doesn't even just equate down to breastfeeding. It's everyone's going to have some comment or advice with anything you do as a mum. And it's so true what you says, like just kind of, your mum gut and yeah, be assertive.
Mm-hmm. Absolutely. Yeah. Stand up for your beliefs and what you think is right, because like we said before, what's right is for what's right for mum and what's right for their baby, not what's right for somebody else.
Amazing. So my next question is for about the working mums or mums going back to work. So can you debunk the myth that breastfeeding and working full-time are mutually exclusive? So what advice do you have for working mothers trying to balance both?
Mm. Yeah. And this is a really good question because in Australia, most women will return to work or study in some capacity in the first few years of their baby's life. So with the right support and information, there's really no reason why breastfeeding should be unable to continue. in Australia, there's actually laws in place that do protect a woman's right to breastfeed, and to assist in preventing workplace discrimination due to breastfeeding. So I guess some advice and suggestions about how to manage your return to work and breastfeeding. It really does vary depending on different situations or different factors. So, things like the age of the baby, what are the baby's care arrangements going to be? Like, are they going to be in daycare, or are they going to be taken care of by family or friend? Is the baby nearby? Can they drop in for a quick breastfeed, or are they far away? So how is that baby actually going to be fed? It can also depend on the mum's type of employment, what kind of hours she works, how much support she has in her workplace. So there's so many different things that can play a bit of a role. But in general, things that could apply to sort of most mums would be, firstly, planning ahead. So, do some research, speak with your employer to create a plan, and then obtain any items that you'll need to sort of make it happen. So I think planning in advance well before going back to work can really help ease that transition. So speak with your employer about your intention to continuing breastfeeding. Find out what's available, what resources are there in the workplace for you to breastfeed. Is there somewhere quiet, private, comfortable for expressing breast milk? Is there the right facilities to store breast milk? So, that doesn't mean that mums should be going to the bathroom and hiding on the toilet while they express milk. That's not okay. Mums deserve a comfortable, hygienic space to express breast milk. Again, is there appropriate facilities? So is there access to a fridge? Is there clean running water? If not, what can be put in place to make that happen? I've heard stories of some mums who will return to work and they don't have access to a fridge, if they work out in construction or, out in a field or wherever it might be. Those mums might need to consider like bringing an esky with some cold packs so they can store their breast milk. So they're just some examples. Things like, is there access to a power point? So if there's an electric breast pump that might need plugging in, then of course that would need to be considered. And then if not, considering using a battery powered pump or a manual pump or even just hand expressing could be some alternatives. And then looking at hours and speaking with your employer about putting in the right breaks for breastfeeding or lactation, and then coming up with a plan that's mutually suitable. So what works with the employer, and then more importantly, what works with mum, and making sure that she is removing milk when she needs to be. And then, as I mentioned before, planning how your baby is going to be fed while you're away. So discussing this with their caregiver way ahead of time can also really help to ease any stress. So, for example, is your baby going to be given express breast milk in a bottle, in a sippy cup? When will they receive that? How much? All of those things. Planning that ahead can also, be really, really important.
It's funny you say that because I've got so many friends who were exclusively breastfeeding and their babies never took bottles. So they kind of, they never bothered pumping or anything like that because they wouldn't take a bottle. So when they started working back at the hospital with us and obviously doing shift work and things like that, they were pumping. And the only way they would get their baby to have the express breast milk was literally from like a little sippy cup. Like they wouldn't touch a bottle, but they would have a little cup. And that's the only way they could get it into them. But it was to the point where they're like, do you know what? They take it. It works, but babies will do what they want to do.
Oh, and that is just so common. A lot of breastfed babies, they don't know what to do with a bottle.
Yeah.
So often they won't take one if they've never had one. And if a baby's at that age where they can also be eating solids, then something I suggest to mums quite a lot of the time is then um, giving that express breast milk, mixing it in with foods and things like that. Still make sure they're getting the right amount of fluids and intake. So
Yeah.
even these babies, some of them won't take breast milk from anything, not even a cup. So that's when we go,
Yeah.
okay, well, if they're right age, we can then try and add it into foods. Yeah. So there's lots of different tips and tricks that, yeah, can
Clever.
be worked out when they decide to do that. But it is a challenging situation, and I've personally experienced it as well. It can be quite stressful, but there are ways of getting around it.
And that's why it's so nice to have mums giving you that advice, because it's like, well, look, this actually, yes, I'm a breastfeeding counsellor, but also I'm a mum, and this exact same thing happened to me, and we know how difficult kids can be, and stubborn they can be. So for mums that are going back to work and pumping, what tips do you have for maintaining that milk supply and managing that pumping at work?
Yeah, I guess it comes back to the principle that breast milk supply is dependent on milk being removed from the breast. So the more milk that's removed, the more milk is made. So to keep up milk supply when you're away from your baby, milk will still need to be expressed. How often and how much will depend on the age and stage of the baby. Um, when returning home from work, some mums will sort of resume breastfeeding as normal. So often their babies, they've been away from mum for the day and they're really eager to breastfeed when mum gets home. So offering extra breastfeeds when mums are back with their baby can give their supply an extra boost. When it comes to pumping at work, it can be helpful to have practiced expressing milk in advance and get really comfortable in getting the letdown reflex to work and getting the milk to flow. So it's really common for mums to not be able to express much milk. And often mums get really disheartened when they're only seeing a few drops sometimes. But with practice, there's lots of different ways that mums can actually get that milk to flow and get the letdown reflex happening, and things such like, being comfortable, being relaxed, using warmth, massage, looking at pictures of their baby or watching a video of their baby can all help. Another one that I love is that some mums, they'll even cover up that breast pump with a cloth or, something like that. So, they're not looking at the breast pump and seeing how much milk's coming out. So that could be really the key. So, yeah, I guess long story short is making sure that milk is still being removed regularly and then assisting that milk to flow when you're away from your baby. That can all take a little bit of practice and trial and error.
Definitely. So I feel when mums go back to work, and I think all mums in general, we always get this kind of mum guilt, and there's a lot of emotions that come up, and when mums are probably going straight back to work, there's probably a lot of this feeling guilty, and probably that'll kind of adhere to that struggling with breastfeeding. Can you talk about the emotional aspects of breastfeeding and kind of how to manage these feelings?
Yeah, breastfeeding is understandably really an emotionally charged topic. So mums can experience real guilt and they can grieve if breastfeeding is not gone to plan for them, or if they suddenly have to be away from their baby, returning to work. There's so many different situations that could make a mum feel a bit guilty or actually grieve for their breastfeeding journeys. And, when we talk about grieving, mums will go through those typical stages of grief. So that denial, anger, bargaining, depression, and acceptance. So all of these feelings can be felt at any time and not necessarily one after the other. And, it can be quite complex and everyone grieves differently. But I guess the two main things to remember is that you're not alone and that support is available. Support could be in the form of peer support. So whether that's debriefing with friends or partners or family, to help get through that grieving process. And then in some cases, it's also necessary that mums get professional support. So speaking with a grief counsellor, a breastfeeding counsellor, psychologists, people like that are all trained to help support mums through these feelings. So yeah, I guess just knowing that there is support there and that, you aren't on your own and these feelings are normal and it can be really validating, I think. And yeah, really important, really important.
100%. I think as well, we build so much up in our minds as mums and we kind of set the bar so hard for ourselves. And I remember when my breastfeeding journey didn't go as I planned with my first, it was just a nightmare from the get-go. And then eventually it kind of, it ended sooner than I wanted it to. And I remember just opening this tin of formula in tears because I was just so upset with myself. And same thing, I felt guilty. I was grieving that I didn't get to finish that breastfeeding journey like I wanted. And I just remember being in tears. And it's just the pressure and emotions we put on ourselves. And so I remember going when I was pregnant the second time around, I was like, I'm not going to put that much pressure on myself the next time because I remember grieving so much and being so upset by it not working out. And it's funny though, by not putting that much pressure on myself, it happened so much easier, and because I didn't put this pressure on, it just kind of happened and I was less stressed and it was beautiful. But yeah, it is a grieving process. I think when we're mums, we're pregnant, we have this idea of how the baby in pregnancy and everything is going to look. And the reality of these things it's not usually the case of how things actually work out.
100%. And I think, like you were saying with your first, you had to go through that whole process, that grieving process, and then you came to that point of acceptance that this is okay. And that's a really hard thing to sometimes say. And it's just so complex what mums go through. And I think having that support around you is really just the key in getting through it and being able to debrief and talk openly with others, and to know that you're not going to receive judgment for whatever situation you're going through, I think is really the key.
So how important is it for mums to seek out support groups or professional guidance, if they encounter issues or misinformation?
Well, we know that the type of support a mum receives around breastfeeding, it has a direct impact on her likelihood to continue breastfeeding. So research actually shows that a woman is 10 times more likely to breastfeed if she has a partner who wants their baby to be fed in that way. So, being a part of a supportive breastfeeding environment really is paramount. If a mum's not feeling supported from those she's surrounded with at home, then it can be important to reach out to any external groups, like I've mentioned before. So those breastfeeding groups, mothers groups, other breastfeeding friends, seeking out health professionals with up-to-date education and training around breastfeeding. And that way you can be assured that you're receiving the correct advice. In general, International Board Certified Lactation Consultants, or IBCLCs, they are the specialists in breastfeeding. You can actually search to see if there's any lactation consultants in your area in Australia and New Zealand, and that's on the LCANZ website, so LCANZ, and you can punch in your postcode and see if there's any in your area. If not, a lot of lactation consultants will do virtual consultations as well. But then, of course, reaching out if there's no IBCLCs around, then of course looking at your midwives, your GPs, your child health nurses, breastfeeding counsellors. So there is lots of professional support out there as well.
And I think the professional support.
Don't hesitate.
Yes, definitely, and it's important because, like you said, the friends and family, if they kind of haven't breastfed or, it's not the same, and it's nice to have that professional support who's someone's going to be like, okay, yeah, this is your wish and let's help you achieve that wish, and they want what's best for you and the baby.
Absolutely. Yeah. With my first baby, I honestly put down my breastfeeding success to a particular lactation consultant, and I was lost. And without seeing this particular person, I would have given up really, really early on. So, um, yeah, I was just so grateful that I found that person that was able to support me and hold my hand through it all and get me through those little hurdles.
100%. When I was pregnant the first time, I didn't even know lactation consultants existed. Like, I had no idea. And I remember reading the breastfeeding hotline, and they were brilliant, but it's different. Sometimes instead of having someone actually watch you feed and latch, and, you know, it's like I didn't have anyone like that to be able to help me. And then with my second, even though she was feeding straight from the get-go, I booked in when she was like 5 days old to go and be like, look, is this right? And it was so nice to be reassured or give tips. And so I think, lactation consultants are fantastic. If you can have access to them, they're absolutely fantastic.
Yeah, worth their weight in gold. Absolutely.
100%. So my other question I want to ask is about milk. So for me, I read so much about breast milk. You know, I'm a nurse. I love all the science behind stuff. So this was really interesting. So can you clarify the difference between fore milk and hind milk? And is it necessary to worry about balancing them?
Yeah, this is a common one. So a lot of mums worry whether their baby's getting enough hind milk. So firstly, let's just talk about what the terms are referring to.
Yes, yeah.
So typically, yeah, typically, so fore milk is referred to as the milk that is first available to a baby at the beginning of a feed. So this milk is typically lower in fat. The hind milk is the milk that is available to a baby towards the end of a feed and is typically higher in fat. So when the breasts are really full, the fat content will actually be lower. So, for example, many mums will have full breasts first thing in the morning when they wake up. So when they feed their baby will receive milk with less fat content and a little bit more water content. Then as the day goes on and the breasts begin to soften more and they aren't as full, the fat content will then be higher. So a baby who feeds right before they go to sleep for the night will receive breast milk that's higher in fat content. So fat content in breast milk, it does vary throughout the day, and that's exactly the way it's intended to be. So the breasts are pretty amazing at making milk to meet the exact needs of babies. And there's generally no need to worry about altering any breastfeeding routines or feeding patterns to ensure that babies are getting enough fatty milk. So what we recommend is that if you follow your baby's lead to breastfeed when they want it, your baby will get exactly what they need in a 24-hour period without mum having to do anything at all. So, yes, it's a thing, but it's not something that we need to get hung up on and, worrying about, really.
I heard so much about like, oh, they've got too much fore milk or they're not getting enough hind milk. And it just became such a thing. And I was freaking out about these different types of milk. And same thing, I had no idea. And I was like, oh my God, like freaking out. And it's like, it's so nice to hear you say, like, you pretty much your boobs will figure it out for you.
Yeah, they're really amazing and just meeting babies' needs and giving them exactly what they need. And breast milk is dynamic and it changes all the time, and that's the way it's supposed to be. So, yeah.
So my next question for you is about breastfeeding and diet. So when you're pregnant, there's all these things, you can, you can't eat, but then breastfeeding is there still things that food or drinks that mums should avoid?
So the truth is that you don't actually need a special diet, or it doesn't have to be perfect in order to be able to breastfeed. And in general, what you eat will really affect the quality and the quantity of breast milk. So eating a healthy diet is probably more important for the mum's health than anything. In regards to things like caffeine or alcohol. So yeah, caffeine. The amount of caffeine that exists in breast milk can really depend on how well the mum's body will process and eliminate it. So generally, we know that mums can consume around 2 to 3 standard drinks of caffeine per day without having really much effect on a baby. But we recommend avoiding those high dose energy drinks. So caffeine in breast milk will generally peak around 60 to 120 minutes after consumption. So that could just be something to keep in mind if you felt like, your baby was a little bit extra sensitive to caffeine. Regarding alcohol, so this one's, I think, a lot more important. So the concentration of alcohol in breast milk is equal to the concentration of alcohol in your blood.
Wow.
So alcohol, yeah. So alcohol will be present in breast milk anywhere between 30 to 60 minutes after beginning consumption. And time is the only way to reduce the amount of alcohol in your blood and also in your breast milk. So once alcohol is out of the blood, it'll also be out of the breast milk. So as a general rule, this will take about 2 hours for an average woman to rid the alcohol from one standard drink. So then, of course, 4 hours for 2 drinks, and then so on. A couple of other things to consider with diets and things like that. So medications or even herbal supplements. So there's so many out there, and it does get really confusing. So the majority of medications and herbal supplements are safe for breastfeeding mums to take, while some are not. So some medications or supplements can impact on milk supply, or they could not be safe for a baby. So generally, we recommend that you speak with your healthcare provider, your doctor, your pharmacist, or a lot of women don't know this, but in Australia, you can actually contact medicines information centres, and they are available in different states on different numbers. Or if there's an urgent call, you can actually just call the National Poisons Information Centre, and that's 24 hours, 7 days a week. So if you have consumed something and you are not sure if you are able to breastfeed or it's safe for your baby, you can call that National Poisons Information Centre and get them answered. So yeah,
that's fantastic. I've learned so much there. Like, I've breastfed 2 babies and no one ever just said it to me like that. Like, with the alcohol, like, no one gave me that kind of like, 2 hours after one drink. Like, I've researched. And I remember someone said, have a drink as you're feeding your baby, because then it'll be safely, by the time they have their next feed. But no one's ever just said, like, 2 standard drinks, 4 hours. Like, that is clear as day. And also nice to know that coffee doesn't affect too much, because obviously, we're tired, we're going to drink coffee. Like, let's be realistic,
Absolutely. There's also, in regards to alcohol consumption, there's a Feed Safe app that you can download, and that can also help give you confidence in knowing if there's any alcohol in breast milk. So you can put in, how much you've consumed and, how long ago and all those sorts of things, and it can help you figure it out. So if you're one of those people that like an app, the Feed Safe app is the one to have on your phone.
Especially when we're tired, sometimes it's nice for someone else to think about it for us, so we make it as easy as we can. So, like, certain foods don't give the baby wind. Is that another myth? Like, if you eat certain things, will it make the baby have more gas? Like, is that a bit of a myth?
Yeah, there's not a lot of evidence around that. Particular foods, making babies gassy. I think that it's more anecdotal, and every baby is different, and absolutely there may be some foods that some babies don't agree with as much. But in terms of evidence around specific or certain foods, there's not really a whole lot around there.
Yeah, I remember, because my mum said to me that, I remember, like, I'd had baked beans, and she was like, when I was breastfeeding, and she's like, I was eating them, and she was like, be careful with those, Maisie's going to be up all night with really bad wind. And I was like, what? And she's like, oh, yeah, like, yeah, she's going to be really bad. And I don't know if it was just a coincidence or it was in my head. And she was. And then I refused to eat baked beans then when I was breastfeeding. And I don't think it probably was. It was just a coincidence.
Yeah, I know. I was terrified to eat curry because someone told me that if I ate curry, my baby would be really upset. So I
don't know, when you're so tired, sleep deprived.
No.
Yeah, I know, when you're so tired, you're like, I'll take, any chance not to have a bad night.
Oh, absolutely.
So my next kind of questions here about weaning. So there are so many myths surrounding weaning as well. Is there a right time to wean? How should mothers approach the stage? And can you discuss the process of weaning and just how to make it as smooth as possible for mum and baby?
Yeah. Again, weaning, I think, could be a whole nother podcast.
Yeah.
It's quite involved, and every mum situation is super different with this. But at the end of the day, the only right time to wean is when the mother and baby either want to or they need to. So some mothers may need to wean earlier than they want for any medical reason. And, that can be really hard. Also, it shouldn't be the right time to wean is not when, society tells you is the right time. So in our society, there's so much pressure on mums to wean earlier than might be desired or in actual fact recommended. So like I said before, weaning is really dependent on so many factors, and sometimes it's mother-led, sometimes it's baby-led. So sometimes babies decide they've done. I've had mums that breastfeeding beautifully, everything is going well, and then the next week their baby says, no thanks, I don't want the breast anymore, and that can be really stressful. And it happens, so yeah, it's so many different scenarios, but in general, the right time to wean is when it's right for your family, and generally it's made easier by doing it as slowly as possible if that's an option. So often over several weeks or even months. So if that's something that is a decision that can be made slowly, it's always a little bit easier, because weaning is a process of letting go, and it's a process of accepting that change. And it takes quite a bit to process for both mum and baby. So yeah, we're able. Doing it slowly is definitely better than, sudden rapid weaning. But as I said, sometimes it doesn't always go that way. And then, things haven't gone to plan, and, all of a sudden breastfeeding stops when, it was expected to continue. Speaking to people about that and debriefing and getting support with all of those things. And not to mention that weaning, also plays around with hormones a little bit, and naturally feel quite emotional during this time. So yeah, there's so many things that can impact it.
Oh, definitely. So I feel like here I want to start giving some kind of empowering advice. So you're a mum yourself to 2 kids, a physio, breastfeeding counsellor. But what are the most empowering things you want mums to know about breastfeeding?
Lots. So look, I think breasts, they're designed to allow mums to nurture their babies. Breastfeeding is natural and normal. Breast milk is incredible. It contains absolutely everything a baby needs to grow. It's the perfect match. Baby, as I said before, it's a living fluid. It's dynamic. It constantly changes to meet your baby's needs. It can protect your baby from illnesses. It can reduce the risk of illnesses in mums, such as breast and ovarian cancer. It also can reduce the impact on the environment, the economy. It's free, it's clean, it's safe, and it's always available on tap whenever your baby needs it.
So true.
Super convenient.
So true.
Yeah, so there's a lot. And yeah, I think breastfeeding is awesome. But I think, in whichever way that mums are able to feed their babies is also awesome. And there's no right or wrong way. And at the end of the day, like I said, it's what's right for each mum and their baby and for their family. So yeah.
I love that. I love that. Mums empowering mums. That's what we're all about here. Like it's just. So if you could debunk one major myth about breastfeeding right now, what would it be?
It would be that breastfeeding is not painful. So,
Yeah.
so for most mums, breastfeeding it doesn't hurt, and it's most often a pleasurable experience. So while some mums can experience difficulties and pain, especially in the early weeks, this will often resolve once their babies learn to attach and suck properly. Remember what we talked about earlier. It's a learned skill. It takes practice. If you're feeling pain, it doesn't mean that you should just put up with it and that you should suffer. There is help available. So most problems can be sorted quickly and easily, and there's no need to just put up with it or suffer in silence. So pain with breastfeeding is not the norm, and support is available. So I think that would be the main one. So I often do hear that, oh, why put yourself through it? Breastfeeding's painful. Breastfeeding makes you uncomfortable. While there are situations certainly that it can be uncomfortable at times, it's not something that is constant for a lot of mums, and it just takes a little bit of learning or practice or support to make it work.
100%. I love that. It's kind of because you do hear kind of bits, from older generations about, oh yeah, it can be painful, and it's kind of they probably don't remember. And it's just they might remember the moments that were painful, the 2-3 times that it was, not the other rest of their journey. So yeah, I think it's important as well, like you said, to seek out support, like professional support if it is painful.
Absolutely.
So coming to the end of our episode, what final piece of advice or encouragement would you offer to mums who might be struggling or feeling overwhelmed by breastfeeding and with all this misinformation going around? And can you give me some of your reliable resources if they're looking for some more help?
So if you're struggling, speaking with a health professional, lactation consultant, a midwife, a breastfeeding counsellor, or just a healthcare provider is a really good place to start. So then they can also refer you on to further resources. A couple of handy resources to have would be in Australia, so the Australian Breastfeeding Association. They're the peak information and support, and they have copious amounts of resources available. So you can check them out on their website, breastfeeding.asn.au, or you can call the free national 24-hour helpline on 1-800-686-268. Some other really wonderful online supports that I love. I mentioned earlier globalhealthmedia.org. So they have some really amazing breastfeeding videos and information. And another major breastfeeding body is the latch League International. So they're also available online, but they do have sort of counsellors and support people who are all over the world as well. So yeah, there's lots around, but if you're lost and you're stuck, just start by reaching out with a healthcare professional who's knowledgeable in breastfeeding, and they can guide you from there.
Definitely. Well, thank you so much, Leah, for coming on and sharing, all your wealth of knowledge as a breastfeeding counsellor. But I love as well that you're a mum, so you've actually, exactly what it's like, and it's, it's realistic. It's, mums helping other mums, and I love it. And I've breastfed 2 babies, and I have learned so much today. And I really wish I'd listened to this podcast when I was pregnant, because I would have just, this is what I need to do. This is what I need to do. don't do this, don't do this, don't listen to this advice.
Yeah, you're welcome. And thanks for the opportunity to talk about all things breastfeeding. As you know, I love it. And yeah, I just want to be able to help and support mums. That's what it's all about.
Amazing. Thank you so much, Leah.
Thank you so much for tuning into this episode of the Real Mummy podcast. Remember, every mum's journey is unique and you are doing an amazing job. Please be sure to like and subscribe so you never miss out on new episodes released every week. Head over to our website at www.realmummypodcast.com to stay up to date with the latest episodes and dive into our recent blog articles filled with even more mum wisdom and stories. We absolutely love connecting with our listeners, so don't forget to follow us on social media. You can find us on Instagram, Facebook and Twitter at Real Mummy Podcast. Join the conversation, share your thoughts and become part of our supportive mum community. And I'd love to hear from you. Got a topic you want covered? Know a guest you'd love to hear more from? Reach out to us through our website or social media. Your input is invaluable and helps us create the content that matters to you. Thank you for being part of the Real Mummy Podcast family. Until next time, stay strong, stay kind to yourself, and remember, you're never alone on this journey. You've got this.